to talk about an acute low back pain method that I like to use to help people move better and just take some pressure off the spine and let these muscles relax a little bit. So acute phase, we're having muscle spasms. I like to use cups. I think it really helps just in the short term just to help people move a little better. I'm going to show in the static position how we can use it and how we can utilize it. I also like using it with movement as well, where we shorten the muscle, the cup is on, we start moving the cup, active motion and elongate that muscle. But short term here, it's really fairly simple. We always use a lubricant on the skin because it just moves a little better. I have two different cups here. I'm going to stick one on Charlie, and I'm going to stick another one on. I always use two different sizes because I just think I'm going to get as much surface area on that pressure in that painful area as I can, and then I'm going to move it around. So I don't like to bruise people. I don't like to just let them sit there. I just like to let it warm up the tissue a little bit, and then I'm going to move it around here. Now, Charlie doesn't have any low back pain now that I know of, so I probably won't find any adhesions, but as I go through this, you will find a sticky point that I just like to stick and let it sit. Same thing, we're going to move this bigger one and then let it sit. And I'll show you
So
what
this
it
is
looks
how
like.
it'll look on the skin itself. I then can move it, and as you can see, he is getting a little more red. In my opinion, red marks the spot, so he's got a little spot here, maybe an adhesion here, as well as here, maybe a little adhesion. Again, I haven't left him on there long enough to cause any bruising. If it does bruise, it's okay. I personally just don't like to grind on people until they get super red. So this is what it looked like up close. I like using two so I can move them around. You can move them on different body parts. But this is how we use cupping in the physical therapy setting.